Hi, my name is Jaisha Piper, and this is my final health assessment video for the health assessment class. Before I do anything, whenever I come in to see the patient, I'd make sure that I wash my hands first thing. Okay. Hi, what is your name?
Tristan Rush,
Okay, and how old are you, Tristan?
22.
Okay, and your chief complaint today, why are you here?
For a yearly checkup.
Okay. Nothing out of the ordinary bothering you?
Nope.
Okay. Any past medical history, any problems with asthma, heart problems, kidney problems?
Nope.
Anything like that? Any history of depression, anxiety, or mental illnesses? Have you ever had a blood transfusion or been diagnosed with anemia?
No.
Okay. And are your immunizations current as far as you know?
Yes.
And do you get the yearly flu vaccine?
Yes.
So 2014 was your last one, correct?
Yep.
Okay. And any allergies to food or to medications?
No.
And how about any current medications that you take daily, including birth control?
None.
Okay. And have you ever had any surgeries?
No.
And how about any hospitalizations?
Yes.
And what was that for?
Whenever I had my daughter.
And about how long ago was that?
3 years.
Okay. And how's your nutrition?
We try to eat healthy. 3 meals a day.
Okay, and how's your water intake?
I try to drink 6 glasses of water every day.
Okay. And your sleep pattern? How many hours of sleep approximately do you
Probably
get?
8 to 9.
Okay. And are you able to exercise daily?
I try.
Okay. How often do you think you exercise a week?
Probably 4 to 5 times. 4 to 5 days.
Okay. Okay. And number of children that you have and number of pregnancies that you've had?
Just 1.
Okay. And everything was good? No complications?
Mm-hmm.
Okay. And I'm going to ask you a little bit about your family history. Any problems with your mom? Any problems with high blood pressure, COPD, asthma, anything like that?
My mom has high blood pressure.
And your dad?
Nothing.
And your siblings?
Nope.
And how about your maternal grandmother? So that'd be your mom's mom. If you don't know, that's okay.
I don't know.
Okay. Do you know anything about your mom's dad, if he has COPD or emphysema or anything like that?
Maybe COPD?
Okay. And they're both still alive?
Yes.
Okay. And then your dad's mom, do you know much about her history?
Nope.
Okay. And how about your dad's dad?
He passed away.
Okay. Deceased. And I'm just going to ask you a little bit about your social history. How about your living arrangement at home?
I live with my husband and my daughter.
Okay. And what is your occupation?
I am a CNA.
And do you have a religious preference?
I'm Christian.
And any use of tobacco?
No.
And how about any drugs or alcohol, including marijuana?
No. Have a glass of wine maybe every once in a while, but not too often.
Right. Okay. So now what I'm going to do first is I'm going to go ahead and start my physical assessment. And I'm going to start by your skin and your general appearance. And your skin tone looks pink, normal skin colors. And your skin looks dry, not moist. And I don't feel any swelling. Your feet are cold. Okay. Let me see your arms. I don't see no bumps or bruises or lacerations on your arms. Okay, perfect. So overall, your general appearance looks good.
Okay.
go ahead and check your blood pressure. Your blood pressure was 102/72. Does that sound pretty normal for you?
Yes.
Okay. I'm gonna go ahead and check your pulse here. I got a heart rate of 68 and respirations of 18. We'll go ahead and check your temperature. .3. And about how tall are you?
5'4",
And how much do you weigh?
120.
Okay. I'm just gonna go back to the skin and we're gonna move on from the skin and I'm gonna check your nails here. And you've got good cap refill in your nails that's less than 2 seconds. And there's no splitting of the nails. Your skin trigger is also very good. This hand as well, less than 2 seconds, and I don't notice any fungus or anything like that. Your nails look like they're well trimmed and well groomed. And your skin trigger is also good. Next, I'm gonna go ahead and just check through your hair. And first I'm gonna look and I can tell that her hair is thick and short and it looks like it's distributed evenly. I don't see no balding. And it doesn't look like it's too dry or too oily. It looks like it's healthy. Good. And I don't see any signs of any lice or anything like that. Next, I'm going to go ahead and check the angle base of each nail. And what this will tell me is if there is any clubbing of your fingers. And your fingers all look normal, so there's no evidence of clubbing. Okay. Next, I'm going to go ahead and palpate your head. Let me know if there's any pain in there, okay? And your head feels normocephalic. I don't feel any masses or tumors or anything like that. Is there any pain in there?
Nope.
Okay. Good. Now I'm going to feel the temporal arteries. And they are palpable bilaterally. Good. And I'm going to go ahead and listen for any bruits. There's none heard on that side. There's no Brits hurt on that side either. Next, I'm gonna go ahead and I'm gonna move down into your neck. And your neck feels supple and soft, and I don't feel any lesions or any masses or anything like that. No enlargement. I'm gonna go ahead and have you move your neck side to side. And while she's doing that, I can check for jugular vein distension.
Okay, go ahead.
And go ahead and turn to this side. None noted there. And now I just want you to go side to side. How is that? Does that feel okay?
Yep.
Okay. Now go up and down. And left to right.
Like this?
Mhm.
This way again?
Just this way.
Oh, sorry.
Chin to shoulder. Does that feel okay?
Yep.
No clicking, no pain at all?
Mm-mm.
Okay. Next, I'm gonna go ahead and have you hyperextend your head. And I'm gonna kind of fill the trachea's midline. Okay. And then I'm gonna have you swallow. Again.
Sorry.
Good. Okay. Her thyroid is palpable and it's small and normal shaped, and I don't feel any enlargement in that. And it's in its midline too as well. Okay, and then from that, we're gonna go ahead to the lip nodes. And I'm gonna start back here in the back, and I'm gonna check your occipital nodes. And then I'm gonna go to your mastoid bone, or your mastoid nodes. To your preocular. To your tonsillar. To your submandibular. And to your submental. And then from there, I'm gonna go ahead and those are all good. And from there, I'm gonna go ahead and move to your cervical and anterior and then posterior and deep clavicular and then subclavicular. Okay, those feel good. I'm gonna go ahead and have you stick your arms out, and I'm just gonna feel axillary. Sorry.
Sorry.
Okay. All right. And I didn't palpate any enlarged nodes with any of that. Okay, next I'm going to go ahead and I'm going to go to your eyes. First I'm going to look at your eyebrows, and I see that your hair is distributed evenly. And it's not too thin and they're not too full. And they reach the outer side of the eye, and they start right at the crease. And then I'm going to go ahead and look at your eyes, and your eyes look symmetrical as well. And there's no swelling noted. Can you go ahead and close your eyes for me? There's no edema there either. And she has eyelashes that curl up and eyelashes that curl down and go away from the eyes, which is normal. Let's see. I just want you to look straight ahead, and I'm just going to look at the pupils. And the pupils are equal and reactive to light, and they're about a size 2. Okay. Go ahead and close your eyes and don't let me open them. Good. And she's got good muscle tone in there. Okay, go ahead and open them. I'm going to look at the conjunctiva, normal conjunctiva in her eyes, and I don't notice any increased redness. And no crusting around the eyelashes. That's all normal. Now I'm going to go ahead and we're going to test your near vision. Let's see. I'm going to do it up here.
Do I need to stand up?
Nope. Okay, can you read this sentence, please?
Today is a good day.
Okay, good. Any problems seeing that? No blurriness?
Nope.
Okay. Now we're going to go ahead and I'm going to test your peripheral vision. And so what I want you to do is tell me when you start to see my finger.
Okay.
Good. And again.
Okay.
Okay, you have good peripheral vision. And now what I'm going to do is we're going to do the cover and the uncover test. And what I'm looking for is I'm looking for any strabismus. So what I'm going to have you do is I'm going to have you close one eye, and I want you to stare at something on the wall and focus, okay? And at this time, I'm going to watch your other eye, your uncovered eye. And now go ahead and remove it.
Remove this
Uh-huh.
one and open.
Okay, in your eyes, it doesn't look like there's any strabismus. And go ahead and do the same thing with your other eye. It's fixed and it's not moving. Go ahead and let go. Okay, no signs of strabismus noted there. Now I'm going to go ahead and do the 6 cardinal signs of gaze, which is going to do cranial nerves 3, 4, and 6. So what I'm going to do is I'm going to have you follow my pen, okay, just with your eyes. Good. And there was no nystagmus noted there. At this time, I'm going to pause the video for just a second. Okay, at this time, I'm going to go ahead and do the Snellen test for her vision. And what I want you to do is go ahead and cover your right eye. And then I want you to read the third line from the bottom, if you're able.
APEORFDZ.
Okay, good. And now can you switch eyes? And are you able to read that same line?
APEORFDZ.
Perfect. Okay, I'm going to go ahead and stop it again. Okay, so according to your Snellen results, you had 20/20 vision in both your left and your right eye, and those also assess for cranial nerve 2. And now at this time, I'm going to go ahead and dim the light so we can use the ophthalmoscope. And light is on. Just look straight ahead. And as I'm going in, I'm looking for any hemorrhages or any foreign bodies or anything like that. I do notice blood vessels, and I can see that the iris is brown. Good. Everything looks good there. And do the same thing with this eye. I don't notice any hemorrhages or foreign bodies, and I can see the blood vessels in there. And the iris in this side is also brown. Perfect. Sorry to shine that in your eyes. Okay, I'm going to go ahead and turn the light back on. Okay. Okay, from here we're going to go ahead and move on to your ears. And what I'd like to do first is I'm just going to make sure that they're symmetrical and that they sit on her head pretty evenly, and it looks like they do. I'm going to check the auricle of the ear, which is the inner piece of the ear right here, and I'm just going to make sure that it's the same color as the rest of her skin, and it looks like it is. I don't notice any drainage or any lesions or anything like that on her ears. And then I'm going to go ahead and do like a cartilage recoil, and her cartilage recoil is good. On both sides. Okay, any pain with any of that? Okay. And now I'm going to go ahead and use the otoscope. The light is on. Okay. First I'm going to go ahead and check this ear, okay? And while I'm looking in here, I'm looking for any redness, any drainage, any lesions, and I don't notice any of that. I do see a little bit of wax, and I see her tympanic membrane, and it's a pearly gray color, and it's intact, and it's translucent. Otherwise, the ear looks great. Same thing on this side. There's no drainage or redness. no discharge at all, no foreign bodies. The tympanic membrane in this side is also pearly gray and is translucent in color. Good. What I'd like to do next is I'm going to do, this is a test for air conduction on the bone, okay? And so what I'm going to do is I'm going to make this sound and I'm going to put it on the top of your head, and I want to make sure you can hear the sound loud, in both ears, okay?
Okay.
Are you able to hear the sound in both ears?
Mhm.
Okay, so no lateralization is noted there. Good. Next, we're going to do, that was the Weber test. Next, we're going to do the Rhine test. And I'm going to hit it again, and I'm going to put it on your mastoid. And I want you to tell me whenever you can't hear it anymore, okay? And
Okay.
so as soon as you can't hear it anymore, I'm going to place it on the outer side of the ear, just a couple of centimeters. And I want you to tell me when you can't hear that noise anymore, okay? And what we're doing here is testing like the air conduction. And air conduction should be greater than bone conduction by a ratio of 2 to 1. Sorry.
I didn't move that.
Yeah.
Okay. Okay.
Okay, good. So the first one on the mastoid was about 10 seconds, and that one was about 15 seconds. So we're going to do it the same on this side.
Okay.
Okay. Okay, so on the mastoid it was 9 seconds, and right up front it was almost 20 seconds. So that's normal. Okay, next we're going to go to your nose. I do have my little dome. Okay, first I'm just going to palpate your nose, and I don't feel any deviation or feel like any crepitus or anything like that. And how are your sinuses? Is that tender at all?
Nope.
Good. Okay. And I can tell, go ahead and look up just a little bit. Your nares are round. You do have the light on.
My nose.
And I can see a little bit of hair in there, and no redness, no drainage noted. Same thing on that side. It also doesn't look like there's any deviation at all, which is a good thing. Not tender out here at all? Is that tender?
No.
Okay, good. So you got a normal exam on your nose. Next, we'll go ahead and we'll move to your lips, as I'm just assessing. And I noticed that your lips are moist and they're pink. It does look like you have a cold sore on your right lower lip. Is that something that you get quite often?
Yes.
Okay. So I do notice that. At this time, I'd like to grab some gloves. No other sores noted. I'm going to go ahead and have you open your mouth, and I'm just going to check your mucous membranes. And your mucous membranes are good. They look pink and moist. And while I'm in here, let's go ahead and just, good. And I can tell her tongue's midline, her uvula is midline as well, with no edema. And her tonsils are still intact and not enlarged. And it looks like all of her teeth are present at this time. And I don't see any fillings at this time. Now I'm going to go ahead and have you, we're going to test cranial nerve 7. So what I want you to do is go ahead and stick out your tongue, move it side to side and up and down.
Ready?
Mhm.
I got.
Okay, and can you go ahead and smile for me? Perfect. So cranial nerve 7 is intact. And at this time, what I could do if I was doing an actual exam, I could test cranial nerve 9 and 10 by doing the gag reflex, but we will not do that right now. Just know that I would do that by taking a tongue depressor and kind of tickling the back of her throat a little bit, making her gag. Okay, at this time I'm going to go ahead and I'm going to assess your chest, and I'm going to do your anterior posterior chest diameter, and then I'm going to compare it to your transverse, and your transverse, it definitely appears like your transverse is longer than what your anterior posterior chest is, and that's normal. Any pain or pressure here at all?
No.
I'm not feeling any crepitus or anything like that. No lumps, no masses. Same thing in the back. I don't feel any lumps or masses. Okay, I'm going to move around to the back. Now what I'd like you to do is I'd like you to go ahead and say 99.
Say 99.
Say it again.
99.
And say Mickey Mouse.
Mickey Mouse.
Okay, and her tactile emphragmatus is correct, and I'm able to feel that the vibrations over her back, which is normal. Now I'm just going to kind of take a look at her, and I can see that her chest rises and falls equally and is symmetrical all the way across. Go ahead and take a deep breath out, in and out. Good. And respirations are even and non-labored. One more. Good. Okay. I'm going to go ahead now and I'm going to percuss. Okay, and resonance is heard over her lung fields. Now I'm going to go ahead and listen to your lungs. Deep breath in and out. Again. 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 Good. Her posterior lung bases and lung fields are all clear to auscultate, and vesicular lung sounds are heard. Now I'm going to go ahead and listen anteriorly. Deep breath in and out. Again. 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 And one more. And same thing is noted with her anterior breath sounds. They are all clear to auscultate, and vesicular lung sounds are heard. Okay. Next, I'm going to go ahead and feel for her pulses. And I'm going to start here. I'm going to feel for her apical impulse. And so I'm going to go mid-clavicular, and I'm going to go 5 down. And I do feel it there. Next, I'm going to go ahead and move over to her aortic valve, which is 2. feel that. Let's go ahead and take a listen. And from there, I'm going to go over to her pulmonic valve. And then to her second pulmonic valve. And then to her tricuspid valve. And then to her mitral valve, which is also like the apical. And I'll listen here for 1 minute. I got an apical pulse of 71, and there was S1 and S2 was heard without any murmurs or abnormal heart sounds. Okay, at this time we're going to go ahead and we're going to move to your blood vessels, and I'm going to just go ahead and assess the color of your arms, look at the circulation, and it looks like you've got good skin tone. Good skin tone there. And good skin tone in your feet as well. I don't notice any cyanosis or dusky skin colors. Okay, we're going to go ahead and check your brachial artery. And that has an amplitude of a 2. And your radial artery. Amplitude of a 2 as well. Let's check brachial on this side. That's a 2 as well. And so is your radial artery on this left arm. Now we can go ahead and let you lay back here, so I can check your femoral, your femoral and your pedis.
My what?
Okay, I'm gonna go ahead and check your femoral artery, and that has an amplitude of 3 on both sides. Now we'll check your dorsal pedis. And both of those have an amplitude of 2 and are normal. Okay, I'm going to go ahead now and I'm going to listen to her carotid artery. I'm going to have you look away from me. There we go. Can you look towards me? Good. And her carotid arteries are intact and there's no bruits heard at that time. Now I'll go ahead and I'll move to the abdomen. Let's go ahead and just raise your shirt up just a little bit here. And first what I'm going to do is I'm just going to inspect her skin, and I know that her abdomen is the same skin color as the rest of her body. I do see that she has a few stretch marks that are silver in color, but there's no masses, no herniation noted at this time. Okay, so what I want to do first is I'm just going to skin is warm to touch. I'm just going to auscultate. And vowel sounds are heard over the right upper quadrant, or the left upper quadrant, I'm sorry. They're also active in the left lower quadrant. And the right lower quadrant. And the right upper quadrant. Now at this time, I'm just going to percuss. And mostly you can hear tympani just because of the air and the fluid in the belly. I do hear a little bit of dullness over the liver area, just because there is an organ there. Okay. Now I'm going to go ahead and I'm going to palpate, just light palpate, okay? Is there any pain there at all?
No.
And I don't feel any nodules, I don't feel any masses, any hernias, anything like that. Now I'm going to go ahead and do deep palpation. Any tenderness? Anything with that?
Nope.
Okay. Now I'm going to go ahead and palpate for the liver here. And you can find it underneath the 11th or 12th rib. Go ahead and take a breath in. Okay, and I don't feel any masses or any enlargement or anything like that on the liver at all. And you can attempt to fill the spleen, but usually unless it's enlarged, you won't fill it. Okay, I'm going to come over to this other side here. So no masses were noted with the liver. And there was also no enlargements. Okay, now I'm going to go ahead and I'm going to attempt to fill the kidney. Go ahead and take like a deep breath in. Kind of arch your back up. And you don't really feel much of the left kidney. Okay, do it again. And I can kind of feel the right kidney. Okay, now I'm going to go ahead and have you sit up with your legs down. And now I'm going to go ahead and percuss the kidneys. Is there any pain noted there?
No.
No flank pain at all?
Nope.
Okay, good. Now we're going to go ahead and do range of motion. And so what I would like for you to do at this time is, this is part of the musculoskeletal. So I would like for you to go ahead and stand up and walk in a straight line. And while she's doing this, I'm just watching her gait and her balance along with her posture. Okay. And now I want you to move side to side.
Like this?
And go ahead and twist. Good. Your gait appears normal. Can you bend over and touch your toes? Okay, good. And now can you hyperextend your back?
Like this?
Yep, perfect. Okay. And now can you make your knee go in like a 90 degree? Perfect. Any pain with that at all?
Nope.
And how about your other knee? Good. Okay. Okay. Go ahead and sit down. And at this time, I'll go ahead and palpate her back. I'll have you lean forward just a little bit, just your head down. Okay. And I'm just going to palpate her back here. And I don't feel any masses, any abnormal areas. Her spine feels to be intact and midline. I don't see no signs of like scoliosis, lordosis, kyphosis, anything like that. I do notice that the C-spine is concave, and then down a little bit to the thoracic is a little bit more convex, and then lumbar is a little bit concave. And there's no pain in there?
Nope.
Good. And I also didn't notice any crepitus, any noise at all in there. That's good. Okay. I want you to go ahead and raise your arms to your side. Right now I'm just focusing on your shoulder blades. Okay, and now up above your head. And then back down. Perfect. And your shoulder blades are symmetrical without any problems. Okay. Now I like to go ahead and move to your elbows. And I'm just going to assess here, is there any pain in your elbow at all?
Nope.
Okay. Okay. Let's do this elbow as well. Any pain moving your elbow?
Mm-mm.
Okay. And now what I want you to do is squeeze your jaws, squeeze your teeth closed. And your jaw feels pretty muscular. And now I want you to open and close your mouth. And let me know if you notice any clicking or popping.
Mm-mm.
No? Okay. And so that's good. That tests your cranial nerve 5, which is your temporal mandibular joints as well. And there's no TMJ noted there. And then go ahead, chin to chest. Any pain at all with that?
Nope.
Any popping?
Nope.
Okay, perfect. Okay, next I'd like for you to go ahead and wiggle your wrist. Good. Any popping in there?
No.
Okay. I do notice that she does have maybe a cyst on her wrist here. Is that tender to touch?
Not right now.
Do you ever have problems with it?
Sometimes it gets really sore,
Okay.
achy.
Okay. But it don't affect your daily activities, anything like that?
No.
Okay. Now I want you to do finger to thumb, and we're checking your coordination. Perfect. And now I want you to go ahead and hold your thumb and your pinky together. Is there any pain with that?
Nope.
Okay, perfect. Next, we're going to check for carpal tunnel, and this test is called the Fallon test. And what you're going to do is sit like this, and keep your the back side of your hands together, and we're going to do that for a minute, okay? And I want you to let me know if you have any tingling, numbness, pain, anything like that, okay? So go ahead and keep them like that, and we're going to do it for a minute here. Does that feel okay without any problems?
Mm-hmm.
Still no pain?
Nope.
Okay, so the next test we're going to go ahead and do, so you passed that one, the Fallon test, it was negative. Next we're going to do the Tinel test, and what I'm going to do, this also checks for carpal tunnel, but I'm going to flick right here, and then I want you to let me know if you have any tingling or numbness that shoots up your hand or down your arm, okay? Normal?
Yep.
Okay. Anything on that one? Okay, so her Fallon and her Tinel tests were both negative. Okay, next we're going to go ahead and lay down, and we're going to go ahead and check out the range of motion in your hips. And for this one, I want to go ahead and have you raise your right leg up and down. Okay, Any pain with that at all? Okay, go ahead and do your leg. Any pain at all? Okay, next I want you to go ahead and move your knee to your chest. Yep. Any pain with that?
Nope.
Okay, next leg. Anything? Okay, and next I'd like for you to go ahead and abduct your knee. So what that means is you're going to go ahead and bring your leg out and then back in. All the way out and then back in. Again. Any pain in your hip at all?
Oh, I guess. Did you want me to do that
Yep,
one?
yep. Any pain?
Nope.
Okay, good. Next we're going to go ahead and do the ballottement test, and this is going to test for any fluid or inflammation in your knees, okay? And I'm just filling in here for any fluid here in your kneecap. Any pain with that at all?
Nope.
Okay. Seems like you've got a normal ballottement test. Okay, good. Next, we're going to go ahead and do the McMurray test, and this test for any torn meniscus or anything like that. So what I'm going to do is I'm going to have you go ahead and bend your knee, and I'm going to go ahead and I'm going to rotate your foot outwards and then inwards. Is there any pain in that?
Mm-mm.
Outwards and inwards. No pain? Okay. Then come over here and I'm going to go ahead and do this other one. Go inwards and outwards. Any pain?
No.
Nothing in your knee? Good. So your McMurray's test was normal. Okay, next I'm going to go ahead and we're going to check your toes. I'd just like to see that you got good range of motion. If you can go ahead and wiggle and move your toes and your ankles. No problems there. Okay, and I see that her toes are painted. They look like they're well groomed without any problems, no funguses or anything like that. We're going to go ahead and no funguses. Okay, going to go ahead and push down on my hands. Good, and go ahead and pull up. Good, you've got good strength. Now I'm going to go ahead and palpate your Achilles. And do you have any pain in your Achilles?
Nope.
Good. Your Achilles is normal without any lumps or masses or anything like that. And it appears to be strong. Good. Okay, next we're going to go ahead and move to the neuro exam. And what I'm going to do for this exam, for this first one, we're going to test cranial nerve 1. You can go ahead and set up. And this is your olfactory nerve. And what I'm going to do is I'm going to have you close your eyes and I'm going to have you smell 3 different things. And you're going to tell me what they are, okay? Okay, close your eyes. Okay, go ahead and smell this one.
Coffee.
Okay. And go ahead and smell this one.
Vanilla.
And then go ahead and smell this one.
Garlic.
Okay, good. In cranial nerve 2, we already assessed with the Snellen chart, and you were 20 out of 20 on that. And then 3, 4, and 6 we tested with the point of gaze. And then 5 is the trigeminal, and what I want you to do is go ahead and clench your teeth again. Okay. And then I'm also going to go ahead and I want you to tell me whenever you feel a dull or a sharp sensation. I'm going to have you close your eyes.
Where are you doing that at?
On your face. So go ahead and you're just going to tell me if it's a dull or if it's sharp.
Dull. Oh.
Is that dull or sharp?
Sharp. Oh.
Okay. Good. Okay. And then I also want you to go ahead and close your eyes. And I'm going to point to a spot on your face. And I'm going to touch it. And what I want you to do at that time is tell me where at that I'm touching you, okay? Okay, close your eyes.
My forehead? Is that
Mm-hmm.
nose? Cheek? Chin? 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 Cheek?
Okay. Okay, good. Your cranial nerve 5 is all intact. It appears to be. Next, we're going to go ahead and do cranial nerve 7, which is your facial nerves. So what I want you to do is I want you to close your eyes really tight and then open them really wide and wrinkle your forehead. And then I want you to go ahead and puff out your cheeks. And go ahead now and act like you're whistling. Okay, good. And can you smile and show me your teeth? Good. So cranial nerve 7 appears to be intact. And through all of those cranial nerve 7s that we went over, I didn't see no tics or abnormal movements or asymmetry in her smile or anything like that would lead me to believe that something else is going on. Okay, next we're going to test cranial nerve 8, which is the acoustic cranium. And what we're going to do is we're going to do the Romberg test. So I'd like for you to go ahead and stand up. And I'm going to have you close your eyes. And what I'm going to do is I'm going to give you a slight push and you should be able to catch your balance, okay? Close your eyes. Okay, good. And then cranial 9 and 10, we've already discussed that is for the gag reflex, but we're not going to do that at this time. And then cranial nerve 11 also tests your the muscles in your trapezius, and this is done by the shrugging the shoulders that we did earlier. Shrug up and down. Again. Okay, perfect. And then cranial nerve 12, we're going to go ahead and test that by testing the muscle in your tongue. And so what I want for you to do is you're going to go ahead and take your tongue and try to push towards your cheek, and I'm going to push against it. Okay, other side. Good. Her cranial nerve 12 is intact. Okay, next we're going to move on to motor skills and coordination. And we'll go ahead and let you lay down or sit down. And for this one, what I want you to do, you're going to use your hands and you're going to go, okay? Good. That's intact. And then next, I want you to touch your nose, okay? And then touch your nose with your other finger, okay? And now close your eyes and do it again. Okay, now open your eyes and touch your nose and then touch my finger. Touch your nose.
Same hand?
Yep, touch my finger. Touch your nose, touch my finger. Now next hand, touch your nose, touch my finger. Nose, my finger, nose, my finger. Good. And we already did the Romberg test to check your balance as well. Okay, the last part of the coordination is to go ahead and have you lay down. And what I want you to do at this time is you're going to go ahead and take the heel of your foot and rub it up and down your opposite shin. Good. And the other one? Good. And that is normal. Okay, the next thing we're going to do is called stereogenesis. And what I want you to do is I'm going to have you close your eyes and I'm going to put an object in your hand and I want you to try to describe it to me and tell me what it is, okay?
Okay.
Here's the first one.
I use both hands. Oh, a paper clip.
That's correct. And here's the next one.
A coin.
Okay. And here's the last one.
A key.
Perfect.
Now open my eyes.
Yeah. Okay, and next what we're going to do is called graphesthesia. And what I'm going to do is I'm going to act like I'm drawing something on your hand. It'll be a letter or a number, and you try to let me know what it is, okay?
Okay. And close my eyes.
Close your eyes.
Yeah, we'll do it again. A 6. An 8.
Okay.
Again. And I don't know.
Do it again.
A 3,
Uh-huh. Last one.
a 1.
Okay, perfect. I. Okay, next what I want to do is go ahead, I'm going to test your reflexes. And we're going to start with your brachial reflex, okay? Actually, we'll start with your bicep first, reflex first. Okay, good. Okay. And then I'm going to go ahead and do your tricep. Go ahead, I'll just hang your arm down. Kind of relax your arm there. There you go. Okay, good. Sorry. Okay. And now we'll do your brachial radial. And this one, you can locate it just about an inch above the wrist. Okay. And now we'll go ahead and have you go ahead and come to the edge of the, there you go, just a little bit. And I'm going to do your patellar, okay. Yeah, just, yeah,
Sorry.
Okay. Good. I'm going to go ahead and have you lay down. And the last one here I want to do is your Achilles. Just kind of bend your leg. There you go. Okay. We'll do the same thing to this side. Just kind of dangle your foot. Good. Okay. And I would give all of those a 2+ for their grade. And at this time, what I'll do is I'm going to go ahead and stop the video and prepare for the rest of my assessment. Hello, so this is the end of my health assessment video for our class, and right now I'll be describing to you how I would assess the female and the male genital systems, starting with the breast and the axilla. So for a patient that comes in for a breast exam, I would make sure that they are sitting on the table with their arms hanging at their sides and kind of free-flowing. From there, I should be able to note the breast, and I should be able to determine the symmetry of the breast, note any enlargement, the size, the shape, the color, also the contour, the skin tones of the breast, along with lesions, textures, and vein patterns. From there, I would go ahead and I would assess each nipple and the areola, and I should be able to determine if they are symmetrical with each other, along with the color, the size, and the smoothness of the areola. And I should be able to know if the nipple is inverted, everted, or retracted. Next, I will have the patient raise her hands, and while she's raising her hands, I'll check for symmetry of the breast as well. You can also do this a couple different ways. First is by having the patient place her hands on her hips, and then the second is by having the patient in the recumbent position. And then from there, I'm going to go ahead and I would palpate the breast with the 3 pads of my fingers. And as I'm doing this, I'm going to be pushing firmly in a vertical manner, starting at the tip of the breast and then palpating downward and then upward over the entire breast. And here I'll be assessing for any nodules, any masses, lumps, pain, any warmth of the skin that might lead me to believe that maybe there's some kind of infection going on. And then from there, I go ahead and move to the lymph nodes, and in the apex, and the medial, and the lateral, and then the anterior, posterior walls of the axilla, along with the subclavicular areas. And there I'm going to be noting any enlarged nodes or any pain or tenderness with palpation. And then next, I'm going to go ahead and move to the female genitalia. And with this, I'm going to start off by having the patient empty her bladder. And after she empties her bladder, I'll help her get into the lithotomy position with her legs spread. And first thing I'm going to do is I'm going to assess the pubic hair of the patient and note the disbursement of hair and whether or not there's any balding areas, along with any signs of like lice or nits or things like that. At this time, you could ask the patient if she's been having any discomfort or any burning or itching. Next, I'll go ahead and I would move to the labia, and I would assess the labia for symmetry and color. I would also note how moist or how dry the labia is, along with whether or not there's any lesions, redness, discharge, if it looks like there might be any trauma or stretching of the labia, or any other signs of inflammation as well. From here, I would have the patient bear down, and as she's bearing down, I would go ahead and I would assess for any bulging or urinary incontinence. And then next, I would go to the perineal and the anus, and I would assess for any skin tags, any lumps, any masses, tenderness, lesions, or redness. And then from the female genitalia, we'll go ahead and move to the internal genitalia speculum exam. And I would start this exam by first choosing the speculum that best fits my patient based on size. And it's important to make sure that the speculum is well lubricated with either water or a water-based lubricant. Next, I would insert the speculum into the vagina, and I'm searching for the cervix. And as soon as I see the cervix, I'm going to note, I'm able to palpate the cervix, and I'm going to note the color, the position, any surface characteristics, along with any discharge, the size, and the shape. At this time would be the best time if you're going to do like any collections or smears. It would be your best time to get these collections now for culture. As I begin to withdraw the speculum, I'm going to be assessing the vaginal wall for increased redness, any excoriation, lesions, red patches, red or white patches, discharge, bleeding, cracks, nodules, things like that. Onto the bimanual exam. Before attempting this exam, it's important to make sure that your patient is aware that you'll be examining her internally with your fingers and gloves. And you're going to start this by palpating the vaginal walls for smoothness, tenderness, any lesions, and nodules. Next, you'll palpate the uterus for location, position, size, shape, contour, and mobility. Next, you can palpate the adnexal and the ovaries, and here you're going to assess for a smooth, firm, ovoid filling, and you'll note that it's usually 3 by 2 by 1 centimeters in size, approximate. And with this, you're going to note any tenderness, enlargement, or any nodularity. And then on to the rectovaginal exam. I'm going to start this by placing my index finger in the vagina and my middle finger against the anus and asking the patient to bear down. While she's doing this, I'm going to assess the sphincter tone and palpate the rectovaginal septum for any thickness, for any nodules, and also for the actual muscle tone itself. And I'll also palpate the posterior aspects of the uterus for masses and nodules as well. Next, we'll move to the male genitalia, and I would start the male genitalia just as I would the female genitalia, and I am first assessing the pubic hair for distribution, any signs of lice or nits. Next, I would assess the penis, and there should not be any hair on the penis, and there should just be a scant amount of hair to the scrotum. If the patient is not circumcised, it's important to make sure that we pull the foreskin back to assess as well, and to assess the glands of the penis. And here you'll notice, and you should assess the color, any signs of inflammation, lesions, discharge. And this might be, this would be like one of the places where you might notice the white curdle-like discharge, the smegma. I would also begin to palpate the penis for any tenderness and induration. And I would then move to the scrotum and the ventral surface of the penis. And here I would inspect color, texture, and then any asymmetry in the scrotum sacs. And then also you would assess for the presence of a hernia. You could also palpate the inguinal canal for direct or indirect hernia also. Next, I would move to the testes and the epidermis and the vas deferens, and I would assess for the size, symmetry, consistency, any bleeding, lumps, or nodules as well. And then next, I would move to the anus, the rectum, and the prostate exam. And first off, I would have the patient get into a position such as the knee chest or the left lateral with the knees and the hips flexed, or the patient could even stand up with his hips flexed and the upper part of the body supported by either the table or a side table. First, I would inspect the sacrococcygeal area and the perianal area for smoothness. And then you could also note any lumps, rashes, inflammation, excoriations, scars, pilonidal dimpling or tufts of hair that's on the pilonidal area. And all of these, especially with the pilonidal area, are kind of indicative of like a spinal injury, or not a spinal injury, a spinal disease. Let's see. And I would make sure that whenever I am assessing these, I would also assess the anus for any lesions, fissures, hemorrhoids, polyps, any masses, any skin tags, things such as this. And then it's important that while you are assessing these, that you describe them maybe based on like the clock rotation, so that if a skin tag is at 1 o'clock, that you're documenting it's at 1 o'clock, so that it's findable and seeable by everybody else as well. Next, I would have the patient bear down, and while he's bearing down, I would insert my finger into his anal canal, and the patient may feel like he's going to have a bowel movement, and this is typical, but just reassure him that the patient won't be having a bowel movement. Then I'll ask the patient to tighten his external sphincter, and he should be able to do this without any problems, and this helps me test the muscle tone of the sphincter. I will palpate the muscular ring for smoothness and evenness. Next, I'll palpate the lateral, posterior, and anterior rectal walls for any nodules, masses, polyps, and prolapses. Next, I'll palpate the posterior surface of the prostate gland on the anterior wall of the rectum. And here I'll note the size, the contour, the consistency, and the mobility of the prostate. And the gland should feel firm and smooth and slightly movable, and kind of will resemble a pencil eraser. I would then have the patient bear down while I assess and palpate for increased tenderness and nodules. And then after that, I'll go ahead and slowly remove my finger from the anus. And as I'm doing that, I might notice stool that any stool that I've collected, and I could check that stool for any blood or pus. I should be able to observe that possibly, and if not, you could always use a Hemocool or Guaiac stools to see if there's any blood in the stool. And that is it. Thank you.